Hey, I am so glad that you're here with me today to kickstart off this grounding healing class. It's a 5-day boot camp basically. By the time you're done this class, you're going to understand what connecting to the earth does for every cell in your body, head to toe, and you're going to have experienced some of the results instantly. The musculoskeletal system, the bones and the muscles and the ligaments and the joints that hold us together and allow us to function all day long, is literally the conduit for this healing flow. And it goes throughout your whole body, and it's more powerful than the effect it has on your, say, digestive tract or circulatory system. It's really the basis for how and why it works quickly, and it works in a different way than any other healing modality works. There's so many other ways that grounding supports our well-being, but the absolute most powerful is with your musculoskeletal system, which is often overlooked in the medical literature and overlooked in the minds of clinicians. So I want to start with that because this is going to be very empowering. So let's just start right away with the first study. So they took these patients and they had them carry 1/3 of their entire body weight in barbells on their shoulders and then stand there and do toe raises, going up on tiptoe over and over and over and over and over until it completely fatigued them so much that their muscles gave out and they could not do another one. So it had to be independent of what shape they were in. It was to the point of complete exhaustion, overload, fatigue, with the goal of causing, specifically inciting inflammation and damage to the muscular tissue. So then specifically at baseline, 1 day, 2 day, and 3 days after this fatiguing, trauma to the muscle overload, they followed these patients and had them subjectively report how were they feeling and what was their recovery like from that, as far as pain levels. And more importantly, they took blood at baseline 1, 2, and 3 days later to see what is their blood showing, what are their inflammation markers showing, what's their cortisol showing, what's their creatinine kinase showing, which is the specific indicator of muscle damage. And they did MRIs, and they wanted to look at how quickly the participants resolved from this issue. So, and another thing they looked at was the white blood cell count to show inflammation and the body's response to inflammation. Really interesting study. They only grounded half. All appeared to be grounded. They all had electrodes, patches basically, conductive patches put to the bottom of their foot, and they were all plugged in, and they all slept grounded. Only half of them were sham grounded, meaning the plug did not actually connect to the earth, and so they were not actually grounded, and half were. And so it was a double-blind study. Without fail, all of the ungrounded subjects not only reported significantly more pain and a longer recovery time, but they also had in their blood higher cortisol levels, and most importantly, that creatinine kinase level that shows you that their muscles were damaged and inflamed, way higher, significantly statistically higher. And on top of that, the most important part of the study to me is that their blood, white blood cell count was really, really high. And for the grounded subjects, and they all thought they were grounded or didn't know which category they were in, the grounded subjects without fail not only recovered faster, not only reported and ranked their pain as lower, not only was their cortisol improved, but most importantly, their creatinine kinase level was significantly lower. And even more than that, their white blood cell count, which shows the inflammatory response, your body's feeding white blood cells there to kind of combat damage, not only was it lower, but it was actually better than baseline, meaning those participants had that insult to their muscles to the point of exhaustion and fatigue. And their white blood cell count actually mildly decreased, meaning it was better for them to be grounded and have that strong of a insult to their muscular system than to just sit there, do nothing, and be ungrounded. It was actually healing for them to be grounded to the point where it compensated for the entire exercise strain, and then it actually went beyond that and improved their blood panel. So it's actually showing that it's better to be grounded even if you have to do strenuous activity, better than doing nothing at all. There's actually repair happening during the strenuous activity just because you're grounded. So that's an amazing study. So then that tells you that grounding has the ability to combat and help you recover from physical wear and tear on your muscles more quickly. But let's go further. What if you're not exercising? What if you're just working at your desk and you have pain in your shoulders or tension, or their EMFs are everywhere and it's causing you to strain, or you just get muscle by the end of the day you got these tension headaches or fibromyalgia, sensitivity? What about that, where you're just not even exerting yourself, but just at baseline have muscle tension. Okay, so this was a larger study that took almost 60 patients, and they had them grounded, and they monitored their brain waves. So they hooked them up to an EEG, and they also put a electromyogram onto their muscles through their trapezius muscles, which is the big triangles that cause all that. It's basically where people usually feel those fibromyalgia knots. It's what triggers tension headaches. It gives neck pain. It's those big triangles on either side of your upper back, shoulders, and neck, connecting all of it. And they measured muscle tension. And even though they put the grounding patch at the bottom of their feet, instantly, with absolutely no discernible lag in time, their muscles instantly relaxed. The readings went down instantaneously, showing that even grounding on the bottom of your foot affected the muscle tension all the way up here instantly. Now let's talk about the bones, because the bones are really what provide, the structure to our body and create functionality to our body. And I want to start by telling you a little bit about how bones work so you can understand why grounding is so important to your actual skeletal system. So bones are basically mineral deposits in our body, and we use those to maintain homeostasis. We use the bones in our body to make sure the pH in our body is at an appropriate range, and to make sure we have electrolyte and mineral status that keeps us functional. So they followed participants in just one night, measuring their renal excretion of calcium and phosphorus, because those two minerals show what your metabolism is doing to your bones. Are you leaching minerals from your bones? And in only one 8-hour session of grounding, both calcium and phosphorus renal excretion went down, meaning your bones were protected, decreasing your primary indicators of osteopenia and osteoporosis. So what that means is those patients laid there, and for one night, instead of their body having to go in and pull minerals out of their bones in order to repair from the inflammation of the day, and in order to correct pH, and in order to correct mineral balance, the minerals were allowed to stay in the strength of the bones, and the electrons from the earth were what was able to come in and neutralize and reset balance in the body. And so over time and over a lifetime, instead of leaching away at your bones and creating brittle bones, you are maintaining the integrity of your entire musculoskeletal system. And here's why that's important. Here's why I want to start with musculoskeletal in the first place, because heart and brain seem so much more important, but it's not really, because the musculoskeletal system is the entryway and what makes you conductive and what makes grounding instantaneous throughout your whole body in the first place. It makes sense, that the brain is electrical, so everyone can understand that. Everyone can understand that the heart's electrical. We monitor your EKG and see electrical activity, and that's what drives your circulation. So all those things make more sense. What is not intuitive, but you should be very aware of, and most medical professionals aren't, is that your entire structure of your body, meaning all of your ligaments, all of your tendons, all of your muscle, your skin, and your bone are all conductors. And it goes further than that, because it's not just your muscle, skin, bones, ligaments, joints that are conductors. And it's not just the fluids. It's the actual cytoskeleton of every single cell. Your cell is made up of its own structural system that provides the 3D, keeps it three-dimensional and alive and running. It's got its own living matrix. And so therefore, think of it this way. When you have arthritis, say, in your knee, so taking an anti-inflammatory like Motrin, or even taking something holistic like fish oil, which is great and I highly recommend it, to decrease inflammation in your joints, it's still relying on your digestive tract to absorb those nutrients or that prescription medication. Then it's relying on your circulatory system to take that antioxidant power or that anti-inflammatory power to the site of injury, and then it's hoping that the blood is there and it's enough to infuse into a joint and helps decrease inflammation. Or say you have chronic sinusitis and you have chronic infections going on because of the external environment, the allergies, or it's just the way that you're structurally made up. It just predisposes you to get impactions and to get sinus infections and chronic issues like that, chronic discharge. So if you take an antibiotic, say you cycle through and it clears it up a little bit and then it comes back. Well, the reason is it's got to work on your digestive system. You've got to absorb it. Then you've got to use your circulation to take it all the way up. Now you've got this walled off space that's this chronic smoldering inflammatory thing that's been happening for a long time up in your sinuses. It's restructured itself. Not only have the bacteria inside created mucus and it's called a biofilm. They've kind of defended themselves with this biofilm that they've kind kind of walled themselves off with, but your own body has walled it off as well by putting collagen there, putting structure there, decreasing blood flow to that area, and sort of putting scar tissue there to kind of wall it off, which is the inflammatory response. And it's appropriate. And you want your body to do that because short term, it keeps the pathogens from coming in. Or if it's like a cut, you want that matrix, you want that scar tissue to build up so that you stop bleeding and so that the area becomes stronger. But what you're left with now is smoldering infections, areas where your body has built up a wall, it's stronger against it, but it's also not actively healing it anymore. It's walled it off and it's sort of just agreeing to live like that. And our whole body is filled with areas like that. If you don't have sinusitis, then maybe it's yeast infections, maybe it's chronic candida all over your body, or maybe for you it's UTIs that come and go, or maybe it's just toenail fungus, or maybe it's cavities in your mouth, or maybe it's a chronic tonsillitis issue, or maybe it's a gut issue, a flora issue in your gut. Whatever it is, or maybe it's just allergies and an immune response on that level, or whatever it is, your body is basically learning to live like that. It's learning to live with chronic inflammation, and the way it adapts is by walling it off and decreasing the interaction with it. So now, if you're trying to treat it with an antibiotic, or you're trying to treat it with an anti-inflammatory, or you're even trying to treat it with raw, pressed juices and fresh antioxidants, you're still relying on the digestive tract to carry it to the area you want to affect, and then hoping over time it affects that area. And it does. And so I am an advocate for, powerfully nutritious, antioxidant-filled foods and supplements, certainly, and topical therapies like, a heat pack or an ice pack, and physical therapy that's going in and trying to remodel your scar tissue and connective tissue to give you better structural support, building up muscle strength, chiropractics, regaining a better alignment. All those things work, but they don't work instantaneously like grounding. And the reason is because your body has caused resistance and walled off against those chronic conditions, right? So what grounding does is it actually uses that as its strength. It uses what is walling it off. So like the scar tissue that's there is actually now encapsulating a healing response. So say we're talking back about the sinusitis, and you've built up this like pocket of pus, it's this chronic infection. Your body, like I said, will take a long time to get that antibiotic up there and infusing and changing the situation, and it probably won't fully resolve it, which is why it's going to come back. But with grounding, your body is instantaneously using the conductivity of all the cells in it, plus the heightened conductivity of the scar tissue and the inflammation, also the conductivity of the mucous membrane and the gel going right into the bacteria. It's all conductive, and it's all decreasing inflammation. So it's actually using the walls and the barriers and the ligaments and the tendons and the bone and the inflammatory response to conduct healing energy directly where your body needs it most. So the results are like this. There's a patient who had an old knee injury over half of her lifetime ago. So she was 15 when she got a knee injury, and she's coming for treatment 17 years later. So for more than half her life, she had limited mobility, limited range of motion, and pain, and it decreased her quality of life. So we talked studies about things helping acutely. Instantly your muscle tension. Instantly you're protected from, muscle wear and tear, or a trauma that might have happened. Instantly your bones are protected and strengthened. Well, now let's talk about what happens when it's a chronic thing, like we're talking about this chronic inflammatory response, when you're dealing with this chronic smoldering thing that your body can never really clear. Or in this case, this woman who had a knee injury, she's lived more than half her life with this. She doesn't think it's going to go anywhere. But when you're grounding, you don't have the limitation of the circulatory system, and you don't have the limitation of you're fighting against time, because you're not fighting against time. It's not really that you're going to get arthritis and it's got to get worse over time. What it really is you're going to use the natural conductance of your body to heal. And you can see the inflammation, and after 1 hour of grounding, it's decreased in half. And pain is subjectively decreased too, but I'm looking at clinical studies and I want to see quantitative results. After 1 week of sleeping grounded, the inflammation was decreased by 80%, as was the swelling, and of course the pain was almost gone. And after 1 month, the pain was reported to be completely gone. Range of joint mobility was incredibly improved, and 90% on the thermography of reduction of inflammation. So we're not even just talking about protecting ourselves in what we're doing each day. I'm talking about resolving things that you didn't even think was resolvable. Using the conductivity, the basis of our body is conductivity. So just the bone structure we have, the ligament structure we have, the interconnective connective tissue interconnectivity that we have, and the actual way our cells are made. The gel that our cells use to make the volume, the water that's in our cells, to have an instant response. It's not dependent on digesting something. It's not dependent on absorbing a prescription. It's not dependent even on the food you're eating. Those things can be very helpful and adjunctive, and I certainly refer people all the time to chiropractics or massage or acupuncture or supplements is one of my mainstays, but nothing is as direct as that immediate results of grounding. And I'm talking about not just on acute things that are happening, but on chronic old issues, because now we're speeding relief and anti-inflammatory repair right to an area that may be walled off and encapsulated and not accessible any other way than electrically. And so that is the power of grounding your musculoskeletal system. One cell is all that it takes. One cell, one entry point will electrically conduct through your entire body this healing flow, neutralizing you, releasing muscle tension, supporting your joints, strengthening your bones, all the things we talked about today, and we're going to keep adding on day after day after day of all the other amazing things it's doing. But first and foremost, it's using your connective tissue to speed this healing flow throughout your entire body. So if it's cold and you just touch with one finger and stay bundled everywhere else, you're grounded. If it's hot outside and you can be barefoot, that's awesome, but it's not superior to just being grounded with one tiny little part of your body. So I want you to try and do that for 20 minutes today. And then I want you to go, when you're inside, try and do an hour using either the wrist strap or the hot water bottle or whatever you chose when you signed up for this course. Most people chose a wrist strap, so I'll just stick with that. If you can wear that for an hour, it doesn't matter, where, if it's you put it on your wrist but you're trying to alleviate a headache, it's going to work. It's going to be conductive throughout your entire body, and now you know why. So try that. Track your results, and then meet me back here tomorrow. We are going to talk about the central nervous system. We're going to talk about the neurology going on, and we're going to talk about sleep and your circadian rhythm and how that's very tied into being connected to the earth and grounding your body, and why it's essential to feel your best, especially as it relates to sleep and restorative sleep at night. Okay, so meet me back here tomorrow, and until then, have fun grounding and check out the links below.